In this video, we are going to talk about 6 reasons healthcare is so expensive in the US. So, before starting the video, please like this video. Do subscribe and turn on the notification to our channel for future updates. Everyone, regardless of their health status, is impacted by the rising expense of healthcare. Over the past few decades, it has had a negative impact on people's ability to spend money. Because of rising costs associated with health insurance, American workers have seen an increase in their gross pay, but their net income has remained the same. It is imperative that excessive expenditure be reined in immediately in order to assist in the stretching of medical and hospital resources in order to better deal with the pressure being placed on the entire system. 1. Multiple systems create waste. It is common practice to point the finger at administrative costs as the reason for excessive medical spending. In comparison to the other 10 nations, the United States spends from 3% to 8% of its healthcare budget on administrative expenditures, while those costs range from 1% to 3% in the other countries. Employer-based insurance, private insurance purchased through healthcare.gov, Medicaid, and Medicare each have their own set of regulations, funding sources, enrollment dates, and out-of-pocket expenditures, making the healthcare system in the United States an incredibly complicated and convoluted structure. Consumers in each of these markets are required to make a selection from a number of different coverage tiers, high-deductible plans, managed care plans, HMOs and PPOs, and fee-for-service healthcare delivery models. These plans might or might not include pharmaceutical medication insurance, which comes with its own coverage tiers, deductibles, and copays or coinsurance costs, depending on the situation. This necessitates that service providers comply with a plethora of restrictions regarding usage, coding, and billing. In point of fact, the costs associated with these activities make up the majority of those associated with administration. 2. Drug costs are rising. When compared to people of other developed countries, the average cost of prescription pharmaceuticals in the United States is nearly twice as high as the cost in those other countries. When compared to Europe, where drug prices are government regulated and frequently based on the therapeutic efficacy of the prescription, high drug prices in the United States represent the single largest area of wasteful spending in the United States. The United States spends an average of $1,443 per person on medication, whereas the other rich countries analyzed paid an average of $749 per person. This is due to the lack of price restrictions in the United States. The cost of medication in the United States is 256 times higher than the average cost in other countries. Private insurance companies in the United States have the ability to negotiate lower prescription pricing with pharmaceutical companies, typically with the assistance of pharmacy benefit managers. However, Medicare, which is responsible for paying for a sizable portion of the total national medication expenses, is prohibited from engaging in price negotiations with pharmaceutical companies. 3. Doctors and nurses are paid more. The median annual salary for a family physician in the United States is $214,370, while the median annual salary for a specialist is $316,000. Both of these figures are significantly higher than the averages for other industrialized nations. The salaries of nurses in the United States are significantly higher than those in other countries. A registered nurse in the United States makes approximately $74,250 per year, which is significantly higher than the average pay of $58,041 in Switzerland and $60,253 in the Netherlands. By demanding prior authorization for visits to high-priced specialists, managed care plans, HMOs and PPOs, in the United States may be successful in reducing the overall cost of medical care. It may be possible to reduce medical costs by consulting a nurse practitioner rather than a primary care physician. 4. Hospitals are profit centers. The costs associated with hospital care make up 31% of the total cost of healthcare in the country. The cost of inpatient and outpatient hospital treatment increased significantly more rapidly than the cost of physician care between 2007 and 2019. In 2020, hospital expenditures amounted to $1.27 trillion, representing a 6.4% increase over the previous year. The costs of surgical operations performed in hospitals in the United States are significantly higher than those in other nations. In the Netherlands, the typical cost of an angioplasty to open a blocked blood vessel is $6,390, while in Switzerland and the United States, the cost is $7,370 and $32,230 respectively. In a similar vein, the cost of a cardiac bypass operation in Switzerland is $32,010 while it is $78,100 in the United States. Today, the financial stability of a significant number of hospitals is precarious. In addition, because of the coronavirus lockdown, elective surgeries have stopped, and the number of patients visiting their doctors has dropped significantly. Both of these factors are major contributors to the overall economic downturn. 5. U.S. healthcare practices defensive medicine. As a result of the shared goal of protecting themselves from legal action held by hospitals and doctors, patients may be subjected to further exams and scans, just in case. And the costs of these testing can vary. The average cost of a CT scan in the United States is $896, which is significantly more than the cost of merely $97 in Canada and $500 in Australia. The average cost of an MRI scan in the United Kingdom is approximately $450, compared to $1,420 in the United States. Researchers have come to the conclusion that the reason why it is so expensive to be sick in the United States is not due to the vast number of tests and treatments but rather the high cost of each one. 6. U.S. prices vary wildly. As a result of the complexities of the system and the absence of predetermined rates for medical services, service providers are at liberty to charge whatever prices the market is willing to pay. It is possible for the amount that is paid for the same healthcare service to differ dramatically depending on the payer, i.e. private insurance or government programs, such as Medicare or Medicaid, and the geographical location in which the service is provided. So, that's it for today's video. What are your thoughts on our video? Please let us know in the comments section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button and turn on the notification to our channel before you go. Thank you so much for watching.